diagnosis of congenital hypothyroidism, neonatal screening to measure TSH age level 24 to 48 hours after birth, required by law. Increased TSH level indicate congenital hypothyroidism, as congenital hypothyroidism is usually asymptomatic at birth, since mother T4 passes through the placenta. The symptoms only appear after weeks or months. Screening is therefore important. Untreated severe congenital hypothyroidism lead to creatinine skeletal abnormalities and permanent intellectual disability. Lab test TSH T24 progressions of clinical hypothyroidism, high TSH lower T34, overt hypothyroidism, high TSH low T34, congenital central hypothyroidism, lower TSH, low T34, ultrasound, radioiodine, uptake test, thyroid antibodies, congenital hypothyroidism, a condition resulting from an inadequate production of thyroid hormone at birth, is one of the most common preventable causes of intellectual disability. Early diagnosis and treatment are crucial for normal development, characteristic symptoms, and pathophysiology. Symptoms many infants are asymptomatic at birth. When present, the symptoms may include jaundice, constipation, poor feeding, hypotonia, large fontanelles, microglosia, and hoarse cry. Pathophysiology can be due to thyroid dysgenesis, the most common cause where the thyroid gland is absent, ectopic or hypoplastic dyshomogenesis, metabolic disorder leading to ineffective hormone production, or central hypothyroidism, pituitary or hypothalamic dysfunction. Clinical presentation and diagnosis. Numerous screening. Most cases are identified through routine numerous screening, which measure TSH, thyroid stimulating hormone levels, with or without T4 thyroxine level, Hill-Prick blood spot sample 2 to 4 days after birth. Confirmatory test. If the screening test is positive, confirmatory serum testing is necessary to measure TSH and free T4 level. High TSH and low T4 levels confirm the diagnosis. Physical examination. Although many newborns are asymptomatic, a thorough physical exam may reveal signs such as large fontanelle, microglosia, and umbilical hernia. Imaging thyroid ultrasound or scintigraphy may be used to assess the presence, location, and size of thyroid tissue, especially if thyroid dysgenesis is suspected. Additional tests in case of homogenesis genetic testing can identify specific enzyme deficiency treatment. Levothyroxine therapy. Immediate initiation of oral levothyroxine is indicated to normalize thyroid level and promote hormone development. Frequent monitoring of TSH and free T4 is essential in the first few years of life to adjust the levothyroxine to search for optimal growth and neurodevelopment. Prognosis with early treatment, normal intellectual development and growth can be expected. Delayed treatment associated with neurodevelopmental deficits and impaired growth. Differential diagnosis table. Transient TSH elevation, temporary increase in TSH of resolving without treatment colony in preterm infants, and hypothyroidism or prematurity, low T4 level in premature infants without elevated TSH. Secondary or tertiary hypothyroidism, low T4 with inappropriate normal or lower TSH, suggesting pituitary or hypothalamic dysfunctions. And high-occurrence congenital hypothyroidism is primarily diagnosed through a routine newborn screening with confirmatory tests need for positive screens. Immediate treatment with levothyroxine is crucial to prevent intellectual disability and ensure normal growth and development. Regular monitoring of thyroid function tests is necessary to adjust treatment and optimize outcomes. Early diagnosis and treatment of congenital hypothyroidism are key to prevent its potential long-term sequelae, underscoring the importance of newborn screening programs. So let's talk about diagnosis of congenital hypothyroidism. Neonatal screening to measure TSH level 24 to 48 hours after birth required by law. Increased TSH level indicating congenital hypothyroidism, as congenital hypothyroidism is usually asymptomatic at birth since mother's T4 passes through the placenta. The symptom only after weeks or months. Screening is therefore important. Untreated severe congenital hypothyroidism with creatinine skeletal abnormalities and permanent intellectual disability. Lab test TSH T34 progression, subclinical hypothyroidism, high TSH, normal T34, overt hypothyroidism, high TSH, low T34, central hypothyroidism, low or normal TSH, low T34, ultrasound, radioiodine uptake test, thyroid antibody, congenital hypothyroidism, symptoms. asymptomatic. Symptoms may include jaundice, constipation, poor feeding, hypotonia, large spontaneal microplasia, and holes cry, cataphysiology, thyroid dysgenesis, dysmorphogenesis, hormogenesis, or central hypothyroidism, reverse screening presentation, reverse screening confirmation, reverse screening for TSH, and with or without T4, heel prick blood spots up to 4 days after birth, and confirmatory test if screening test is positive. Confirmatory serological testing is necessary to measure TSH. For T4 level, high TSH and low T4 level, confirm the diagnosis. Physical examination of the remaining are asymptomatic. After medical exam may reveal signs such as large anterior spontaneal microplasia and umbilical hernia. Imaging thyroid ultrasonograph sound and our scintigraphy may be used to assess the presence, location, and size of thyroid issue, especially if thyroid dysgenesis is suspected. Additional tests in case of dysmorphogenesis, genetic testing can identify specific enzyme deficiency treatment. Levothyroxine therapy, immediate initiation of oral levothyroxine is indicated to normalize the hormone level and promote normal development. Monitoring, frequent monitoring of TSH and 54 is essential in the first few years of life to adjust levothyroxine dosage for optimal growth and neural development. Prognosis with early treatment, normal intellectual development and growth can be expected. Delayed treatment associated with neurodevelopmental deficit and impaired growth. Differential diagnosis table, transient TSH elevation, hypothyroxemia, or over prematurely secondary or tertiary hypothyroidism. High yield point, congenital hypothyroidism is primarily diagnosed through routine newborn screening with confirmatory test need for positive screens. Immediate treatment with levothyroxine is crucial to prevent intellectual disability and overall growth and development. Regular monitoring of thyroid function tests is necessary to adjust treatment and optimize